Sitting, Hospital Rehabilitation Unit. Your patient is a 70-year-old woman who has been admitted in the ward following a stroke. Her speech and memory are impaired and she has limited mobility. You have completed her clinical observation. Her son asked you about his mother's current health condition. Now, let's begin the task. First one says, find out the reason behind his visit. Second one says, give information about the patient's condition. First stage of recovery, vital signs are satisfactory, no change in memory and speech capabilities, slight improvement in her mobility. Third one says, find out son's opinion about mother's condition. Fourth one says, confirm the benefit of regular contact with family. Lift mood, energize patient, establishing routine. Fifth one says, remind him about the visiting regulations. Maximum 2 visitors at a time, not during the meal time and treatment time. Make recommendations for visit. Short visit, no constant conversation. Watch signs of tiredness. Sixth one says, advise the son to help the mother mobility exercise together and bring personal items to prompt memories and give encouragement. Seventh one says, advise against patient leaving the ward. The regular monitoring required by nursing staff, need for improvements in patient strength, orientation and mobility. Now let's begin the role play. Good morning, my name is Rosie and I'm the registered nurse working in this rehabilitation unit. May I know the reason behind the visit?
Good morning, nurse. I'm here to see my mother who has recently been admitted here after a stroke. I want to know her current health condition and the progress.
I completely understand your concern regarding your mother. Try not to be worried. I'm here to help you. May I know your name for a better communication?
I'm Robert.
Thank you, Robert. Can you please tell me your mother's name and age for verification?
Yes, nurse. My mother is Catherine and she is almost 75 years old.
Okay, Robert. Thanks for the confirmation. I have just completed her clinical observation. Based on my assessment, I understand that she is in her first stage of recovery and currently her vitals are satisfactory. However, I did not see any improvement in her mobility and speech capabilities, but I can see a better improvement in her mobility. Please set your mind at ease. She shows some good sign of recovery. Okay, Robert. I hope you have visited your mother today. Please let me know your opinion regarding your mother's condition.
Nurse, I visited her today morning, but I could not see much improvement in her condition. She's making some slow movements and her condition has slightly improved now. I'm a little disappointed with her condition. Okay, nurse, I do not think that I can see my mother in such a situation for a long time. So can you please tell me what can be done to improve her condition a little faster?
I can completely understand your worries, Robert. As you know that she is already on medications and other treatments. Moreover, stroke patients may take little longer time to improve their condition. But don't worry, I can suggest you certain measures to improve her condition. Is it okay with you?
Sure, nurse.
It will be a good idea to visit your mother frequently along with your family. Therefore, it can lift her mood and energize your mother. Moreover, it may also help her to pass time during your visit. You can also support her in establishing her daily routine. Okay, Robert? I hope you are following me.
Yes, that's a great idea, nurse. I'm ready to visit my mother with my family. But I just want to know that if there are any kinds of restrictions or regulations behind the visit.
Your thoughts are reasonable, Robert. Yes, there are some regulations for the visit. Let me explain you that in detail. First of all, only 2 visitors are allowed at a time. Secondly, you are not supposed to visit your mother during the mealtime and treatment time. Finally, it is always better to visit your mother for a short durations and avoid constant conversation with your mother. Most importantly, you need to observe her for the signs of tiredness or any other discomfort. If you notice the same, please report us immediately. Okay, Robert? I hope you are with me.
Sure, nurse. I got it now and I'm okay to follow your instructions.
I am happy to know that, Robert. In addition, I would also like to inform you that you can assist your mother to do some simple mobility exercises together during a visit, which will certainly improve her mobility. You can also help her to recollect memories by bringing some personal things. Also, you can encourage her to do some activities together to help her to improve her memories. Okay, Robert, I hope you're following me.
Yes, nurse, I understand that. But can I take my mother outside now so that she can feel the sunlight and fresh air? As you know that she has been lying on the bed for a little longer time inside the room.
I completely understand your worries, Robert, but unfortunately, you're not allowed to take your mother outside as she requires constant monitoring by the nursing staff. Moreover, she needs little more improvement in her strength, mobility, and orientation. So I can assure you that you can take your mother outside once she has improved her condition. Okay, Robert, do you have any more questions for me?
No, nurse, thank you very much.
Okay, Robert, so far we have been discussing about your mother's current health condition after the stroke and certain measures to improve her condition. I hope you understand that. If you have any more questions or concern, you can get back to me at any time. I'll be glad to help you. Thank you, Robert, for your visit to the rehabilitation unit. I wish your mother a speedy recovery.
Thank you, nurse. Thank you very much for your support.
Thank you, guys. Our role play ends here.